It's my honor to introduce your speaker. Boyd Rutherford is the 9th Lieutenant Governor of the state of Maryland. He was elected to office with Governor Larry Hogan in 2014 and re-elected in 2018. He's the first Republican Lieutenant Governor to ever be re-elected in Maryland. An accomplished attorney with a lifetime of experience in both the public and private sectors, Rutherford has served as Associate Administrator for the U.S. General Services Administration, as Assistant Secretary for Administration for the U.S. Department of Agriculture, and as Secretary of the Maryland Department of General Services. In addition to his public service, he has extensive legal and business experience, including service in business and government law, information technology sales, and small and minority business development. As Lieutenant Governor, Rutherford has been a strong partner with Governor Hogan, leading the administration's efforts to combat the opioid epidemic, reform burdensome regulations on job creators, and break the cycle of poverty between family generations, and they're doing a great job on that. Lieutenant Governor Rutherford holds a bachelor's degree in economics and in political science from Howard University. Additionally, he has a master's degree in communications management and a law degree, both from the University of Southern California. A native of Washington, D.C., Rutherford currently resides in Columbia, Maryland, with his wife, Monica. They have 3 adult children. And on top of all that, he's a really great guy who really cares about the issues, especially this one. So I'd like you to put your hands together. Please welcome Lieutenant Governor Boyd Rutherford. Thank you again for being here.
Nice introduction. Good job. Wow. Good morning. I'm gonna see if I can put this in here. No, it doesn't look like it fits. I'll hold it. Well, good morning to you all. Good morning. Thank you. Thank you. Well, I'm glad to be here. Thanks for the opportunity to speak to you all this morning. As you may or may not know, but it was mentioned in the introduction, the governor and I have been working very hard to fight against the heroin and opioid epidemic that we have in this state that is killing hundreds of Marylanders every year from this. And we've been focused on this for the last 4 years, and I'd say really last 5 years, because when we were first running, we talked about this issue and said we would be laser focused on how we're going to approach the challenge before us. And we're looking at taking a multi-pronged approach to this, starting with prevention and education, treatment and recovery, as well as enforcement. And as you all probably know, you were in middle school, so you know more than what a lot of us adults know about this, is that it doesn't matter who you are or what neighborhood you come from, folks are affected by this every day. It's not just something that happens in another part of the county or in somebody else's neighborhood. It is with you, it is with us all around us. Just yesterday, I went to a funeral of a friend and colleague's son who had died from a heroin overdose. And so it affects everyone in every community. With that in mind, that's why the governor put together the Opioid Emergency Task Force several years ago and asked me to chair that. And we had meetings all over the state and came up with many recommendations, some 33 recommendations, ranging from prevention to education to expanding treatment opportunities and recovery, as well as better coordination with law enforcement and identifying effective ways to treat people and alternatives for incarceration for those who are suffering. And our agencies have been working very hard in the last several years to implement these recommendations, but we needed to take an additional step. As the challenge continued to grow, we declared a state of emergency in the state. Now, the governor has declared states of emergency when there was the flooding in Ellicott City, and unfortunately, a couple of people died there, 3 people died. He declared a state of emergency when we had the riots in Baltimore. Unfortunately, no one lost their lives. But when we have 1,000 people dying from an overdose of heroin or prescription medications, that is an emergency. And so when he created that or declared the state of emergency, it allowed us to work more closely with the local officials at the state level. Now, I know you all have had some civics, so you understand the difference between the state government and the local county government and the municipal governments. This allowed us to work closer with them to work to address the issues, as well as coordinate with the health departments, the local health departments, the emergency management personnel, and the human services folks. Now we have to, continue our efforts, and we're seeing some progress. Overdoses from prescription medications have been on the decrease, and the same for heroin. However, there is a new, stronger synthetic called fentanyl that is out there, and that is resulting in 80% of the fatalities, the deaths associated with overdoses have to do with fentanyl. And fentanyl is not just put in, you may be sitting there thinking, oh, I'm not going to use heroin, I'm not going to take prescription medications. All I'm going to do is I'm going to smoke a little bit of weed, or I'm going to do this, or I'm going to do that. They're putting it in these other substances as well. And people are dying from that. Cocaine, they're mixing it into cocaine as well. And now the mixture of fentanyl and cocaine is the leading killer in our state when it comes to substance use. So we're not going to stop fighting this. One of the ways is through education and presenting this information to you all so that you know that it is a dead end to even start on that track of either taking someone else's prescription medications or trying to experiment with some of these illicit drugs. And I know something that has become somewhat controversial in recent years, but it shouldn't. There is a traditional pathway to drug use and addiction. And that traditional pathway is tobacco, alcohol, and marijuana. And I know you may hear people saying, oh, marijuana is not harmful. My uncle told me he used to smoke when he was in college. But you talk to that uncle and he'll tell you that he knows people that wasn't enough, that they continued on to other things that were more powerful. And the marijuana that your uncle may have smoked back in the 70s is not the same as what they're smoking today. It's much more powerful. And for young people, there's some studies that are showing that it can result in mental health issues. So I just wanted to point that out. But we all know that we're not going to arrest our way out of this. It is not simply a law enforcement issue. And I like to say we make a distinction between those who we're upset with and those who we're afraid of. Those who we're upset with may be people who broke into our car or stole something to satisfy this addiction, the sickness that they have. The folks that we're upset with are the people who are killing people on the streets or who are trafficking in these poisons that are coming into our communities, and they're using violence and intimidation to protect their territories and their markets. Those are the folks that need to be arrested and put in jail and locked up. So we'll continue with the law enforcement efforts associated with those dangerous folks. But for the people who it's really their sickness that's an issue, we'll try to get them in treatment. Now, they need to have some sanction, but the main thing is to get them help so that they can return to being productive citizens. Now, I want to mention something that's somewhat separate, but it is related. And that is, it is time that we also take a serious exploration of how we deliver mental health services. In many cases, people will seek to self-medicate when they have undiagnosed mental health issues. And we need to take away the stigma associated with mental health so that people do seek help when they feel that something is just not right with them, that their logic has changed, and that the families will seek help, and that you will point to the authorities in your school, be it your teachers, your counselors, your principal, assistant principal, where you see someone is struggling in your school, that someone is having some kind of difficulties, it is worth saying something, even if it turns out to be nothing at all. So additionally, those people who have undiagnosed mental health issues are more likely to be homeless and jobless, have negative interactions with law enforcement, and in many cases become victims of crime, and of course suicide is an issue as well. So, and these don't just affect the individual, but it affects the family and the communities that they live in. And it's very difficult to get assistance for these children, and that's why we are, children as well as adults, that is why we're focusing a lot of our efforts in this year and continuing on how we deliver mental health services and how we can improve those services. Now, none of this is easy, but I do believe that those of us who are in public service, we can't just sit back and do those easy things that look good in the newspapers or on TV. Well, you all probably don't even know what a newspaper is. I'm sorry, I take that back. The teachers know what the newspapers are, but that's something of the past, although I do still read newspapers. But I do think that those of us in public service need to tackle those difficult issues, those things that are not going to be as popular and sometimes people don't want to talk about, but they are there. And that is our job, to tackle those issues. And I like to paraphrase the former president. I would hope that you all know the name John F. Kennedy. Now, he was talking about going to the moon, but I like what he was saying in terms of how it relates to public service, that we choose to do this and other things not because they're easy, but because they're hard. And he went on to say, because that challenge is one that we are willing to accept and are unwilling to postpone. And so when it comes to addressing the heroin and opioid issue, the epidemic in our state, and those who are dying from it, that is something that is not easy, but we can't postpone it. And the same goes for how we deliver services for those who need mental health services as well. And so we'll continue to work with our partners at the state and local level, as well as our federal partners, to make sure we address this. And it's going to take all of us, from government to private industry to the nonprofits and our faith communities, to work together to make sure that we resolve these problems as well as save lives. Because the bottom line is saving lives. So I want to thank you for the opportunity to talk to you. Hopefully I can come to your schools and I can answer the questions that you may have. As my staff will tell you, I do answer every question, or in some cases refuse to answer your question, but I'm not going to walk away from it. So thank you very much for sitting and indulging me this morning. Take care.